Good morning, everyone. My name is Andrea Contreras Gonzalez. Today, I am speaking to you about a broken system that was meant to heal, but too often harms. The U.S. healthcare system is failing the people that need it the most. While Christ modeled compassion and healing, our system favors wealth, status, and privilege, leaving behind the sick, the poor, and the voiceless. As Christians, we are called to do more than notice injustice. We are called to respond. Access to healthcare in the U.S. is often limited by employment and insurance, leaving millions underinsured and uninsured. In California, employer-sponsored premium for private sector workers have doubled from 2008 to 2023. According to the Kaiser Family Foundation, nationwide insurance costs rose by 52% in 2014 and 24% in 2019. High medical bills leave 41% of adults in debt, forcing many to choose between treatment and daily essentials. Racial and ethnic minorities face even worse outcomes, with higher rates of chronic illness due to systematic inequalities. In 2010, African American adults were twice as likely to have adult onset diabetes and 15% being diagnosed. Immigrants, while often healthier initially, known as the immigrant paradox, face health declines over time due to discrimination, language barriers, and worsening outcomes. This shows why health equity is so important. Health equity means providing and care based on what each person needs. Equality is healthcare does not always work well in practice because some people need more help or different kinds of help than others. However, equality can still help reduce discrimination against marginalized groups. But to truly fix the deeper problems, we also need health equity to address the root causes of social injustice. When care becomes a privilege, instead of a right, something must change. Healthcare in the US was not always built around money. In early history, care was rooted in faith. During the Middle Ages, the Roman Catholic Church led healing efforts believing that illness was spiritual. By the 18th century, Christian leaders like John Wesley reminded people to care for both body and soul, leading to hospital building care for the poor. But the shift towards profit came fast. During World War II, insurance became tied to jobs, meaning if you lost your job, you lost your coverage. Medicare and Medicaid helped in 1965, but private insurance grew more powerful. Over time, the focus shifted from compassion to cost. Healthcare began to serve fewer people fairly, treating it more as a business than a basic need. The U.S. healthcare system faces significant legal and ethical challenges, presenting negligence in providing fair and effective care. For instance, legally, the Emergency Medical Treatment and Labor Act requires hospitals to treat emergency patients regardless of a person's ability to pay. With innumerable Americans being underinsured or uninsured, patients struggle to access necessary follow-up care, leaving gaps in treatments. While the Affordable Care Act has expanded Medicaid for low-income adults earning up to 138% of the federal poverty level, also known as $21,597 for an individual in 2025. However, 10 of these states did not adopt this expansion, which has created disparities in coverage and left millions without proper health care. Ethically, the idea of patient autonomy, the right for people to make their own health decisions, is often limited when they cannot afford critical treatment or medication. The patient's financial constraints derails them from the desired medical procedures. With this conflict in mind, patients wanting certain medical treatments but being unable to afford them because of their financial situation can create a challenge for the doctor, as they might want to help the patient but are faced with the barrier of cost. This is when the situation of wanting to help the patient, beneficence, and not causing harm, non-maleficence, becomes a problem ethically for the doctor. The doctor might feel stuck between the patient's financial problems preventing them from the care the patient needs, even though the doctor wants to do what's best for the patient. Across the U.S., Language barriers, gender discrimination, and unequal care have exposed major healthcare flaws, revealing how America falls behind other countries. America's diversity has shaped programs like the Department of Health and Human Services, and culturally and linguistically appropriate services to help with health education. In the United States, 40% of the 63 million people in the US who speak a language other than English speak English less than very well, defining them as limited English proficient, LEP. People who are LEP experience communication barriers, resulting in poor quality of care and potentially adverse health outcomes. Hospitals are required to provide language services that reflect the needs of people in their communities. But these services are not available to people systematically. Similarly, beyond language barriers, individuals from racial and ethnic minority groups often face additional forms of discrimination in healthcare, making it harder for them to receive diligent care. Gender has also been largely affecting those in the healthcare system. A study done in 2019 found that 52% of women and 36% of men felt gender discrimination to be a serious issue in the healthcare system. It has been observed that women presenting the same condition as men will not receive the same care. For instance, 31% of women have been diagnosed with chronic pain and have reported that they felt the need to prove their symptoms to their healthcare provider, compared to 19% of men. To get a better understanding of how our US healthcare system is compared to other countries, the Commonwealth Fund's Mirror 2024 report compares the US healthcare system to 9 other countries, focusing on access, quality, efficiency, and equity. The US ranked last in access, with many unable to afford care or find regular doctors, while countries like the Netherlands and the UK excel in affordability. In care quality, the US ranked second, doing well in preventive efforts like flu shots. For administrative efficiency, the US placed 9th, with patients often dealing with complex billing, unlike the UK's simpler system. In equity, the US ranked last, showing large gaps in care based on income and race, while countries like Australia offer more equal access. These national challenges deeply affect local communities, including our own, where many struggle to get the care they need. To gain a clearer understanding of community perspectives, a survey was conducted at Faith Christian High School in Yuba City, California, where students and staff members were polled on a series of healthcare questions. The first question was asked, in your opinion, what is the biggest issue facing the US healthcare system today in our community? The respondents were given pre-written answers to choose from. Of those, 57.2% claimed high costs as a top concern when seeking medical attention, followed by 14.3% select lack of insurance, 14.3% poor quality of care, 7.1% health disparities, and 7.1% other issues. These results reveal that cost is a major worry for many individuals in our area. In 2000, researchers from the University of Southern California found that Sutter Health started to use unfair business practices, causing higher prices for medical care. Sutter Health's prices are 30% higher than any other hospitals after forcing insurers to cover all their locations, raising costs for patients. By limiting competition, companies like monopolies can raise prices to make more money without worrying about the competition, offering lower costs. Looking at the local impact in our Sutter County, it's also essential to see how our Christian branches view healthcare and compassion for the sick. The Orthodox Church teaches that healing involves both God's grace and human effort, highlighting the importance of prayer and sacraments, as well as medical treatment in working with God's will. Having this belief shows that the church will only support a healthcare system that is compassionate, accessible, and that aligns with the moral responsibility of caring for everyone. Roman Catholicism teaches that healthcare should be a basic right to everyone, especially to the individuals that need it. The U.S. Catholic Bishop has been advocating to improve healthcare to ensure that everyone, especially the poor and vulnerable, have the respected care that people deserve. Evangelical Protestants have various opinions about the healthcare reform. In 2000, the Pew Research Center found that 18% of white evangelical Protestants supported healthcare bills like the Affordable Care Act. However, about 48% of Protestants overall supported government-provided healthcare insurance for everyone, even if it meant higher taxes. While these Christian denominations show a different perspective on healthcare, they all genuinely follow the Bible's teachings about charity, justice, and respect for others, lessons that can help us to improve healthcare. Jesus healed with deep love and cared for the well-being of everyone. In Scripture, he healed the blind, the sick, and even raised the dead. His healing went beyond the body. It touched hearts and souls. He never rejected anyone for being too poor or too broken. Unlike Jesus, today's healthcare system often turns away those who cannot afford care, delay help, and leaves families in debt. In Mark 12:31, Jesus says, "You shall love your neighbor as yourself." That love including fighting for others' health and dignity. But in America's healthcare system, compassion is often missing. Justice is overlooked. In Psalms 82:3-4, it commands us to defend the poor and fatherless, do justice to the afflicted and needy, deliver the poor and needy, free them from the hand of the wicked. It teaches everyone to defend the rights of those in need, showing a moral duty to make healthcare fair and accessible. In Matthew 9:35, it says that Jesus went about all the cities and villages, teaching in their synagogues, preaching the gospel of the kingdom, and healing every sickness and every disease among the people. His example reminds us that health is more than physical, but it is spiritual, emotional, and compassionate. Today's healthcare system often forgets that. Doctors are rushed, overbooked, and pressured to meet quotas, having to leave patients, especially the vulnerable, feel unseen. In response, many Christians have founded organizations to bring healing and dignity back to healthcare. We are called to advocate for fair and compassionate access to treatment, honoring what Scripture teaches us about caring for others. Practical steps can be taken to be the hands of Jesus in response to the failing healthcare system in the U.S. Jesus pointed out to provide care to those who cannot afford it, similar to Jesus when he cared for the sick and poor. People volunteer at free health clinics, health outreach programs, as well with churches and faith-based organizations creating support groups or fundraisers to assist with medical expenses, showing God's love through generosity and compassion. When reflecting Jesus' mission of healing and serving others, it brings hope and support to those in need. It is up to Christians to advocate for policy changes that promote fair and equitable healthcare, using their voices to stand up for justice and dignity for all. As God proclaimed in Proverbs 31:9, "Open your mouth, judge righteously, and plead the cause of the poor and needy." Now that you have seen what the system looks like from the outside, let me show you what it feels like from the inside. Every treatment I take comes at a cost. Albuterol helps me breathe, but it weakens my muscles. Dupixent calms my skin, but leaves me prone to colds. A painful, burning cortisone shot temporarily lets me walk, but steals my sleep and spikes my blood pressure. I was offered nerve blocks to be pierced near my lungs with an ambulance on standby, a treatment with only a risk. 905-1188. I'm a charted number in an ongoing experiment. I'm a constant cycle of pre-evaluations, blood work, and referrals to new specialists. It's a carousel ride that I've been on for 12 years and I haven't hopped off. It's a ride that never stops as long as cash flow continues through big insurance and pharma. I'm stuck receiving experimental treatments and with a growing folder of undiagnosed health problems. Medical terms do not translate into everyday language. It's not easier for an 8-year-old daughter and a mom with a language barrier. I've struggled watching my mom try to understand while the online translators could not even translate when we needed them the most. Carrying the weight of my own diagnosis and trying to explain it to her made me grow faster than I should have. It planted frustration, in my heart, because how could we get the answers when no one would provide a translator? I have wrestled with these questions in prayer. Why would God place this path in front of me? Why this burden? But even in the dimmest light, I still see him. I know he's walking this path with me. Today I speak with hope to not only see a change in the system, but for change in people. A change that makes us think and feel like Christ. I speak today to shine that light. Every name on a bill, every denied treatment, every crowded waiting room, there sits someone's child, a child of God, worthy of life shaped by his hands. I'm not just a diagnosis. I am not 905-1188. I'm a daughter of Christ. The U.S. healthcare system is not just broken. It's hurting the people it should protect. Sky-high costs, lack of coverage, and unequal access to care leave low-income, minority, and immigrant families behind. Millions live in pain, not because there's no treatment, but because there's no compassion in a system built on profit. This isn't just a policy issue, it's a moral one. As Christians, we are called to fight for justice, to serve the vulnerable, and to demand a system where human dignity matters more than dollars. If we stay silent, we become part of the problem. Here are my resources. Thank you.